Hi everyone. Good afternoon. I have a story to tell. I was on our group site a couple days ago and I talked a little bit about it, but I decided I wanted to add to it and support everybody and tell my story. And I figured it'd be about uh, thousands of words long. My name's Ryan Reeves. I live in Clearwater, Florida. I'm 28 years old. I'm sorry, I'm a little bit nervous, so excuse me. I was admitted into the hospital on July 18th. I hope you can see me guys just fine. I made it to the hospital July 18th, and on July 19th I had a emergency aortic dissection repair and also a aortic valve replacement. Mechanical valve, of course. But I don't know if you can see, my scar. It's healing up very well, and it goes down to the belly where the chest tubes are. My story is to tell you how I feel at the age of 28. I was 23 years old, and I noticed my blood pressure, slowly going up. I was very active. I ran a lot, and I played sports, and I was like, okay. And I thought it was okay. It's normal, I work in pharmacy, who knows. So, trying to make this story not so long, so you don't have to, listen for 40 minutes. But I noticed my blood pressure going up over time, and I said, well, something's not right. I started having palpitations, and I thought at that point that was normal at times, and my doctor and I would talk about it. I, at one point, did not have insurance, and therefore I had to pay out of pocket to go see a doctor, which, if that was opposite, and I wish it was, I would have avoided all this, but this is what happens, like I said, and I hope you can see the scar, because I want to show the story to everybody. So, I went through surgery. Like I said, I had an emergency aortic dissection. As I was going to have a CT scan done, they actually, as I was exiting the room, about 10 different doctors came rushing in, and they were talking medical terminology I did not understand, and they told me that, you're dissecting, and I said to myself, slow down, tell me what's going on. And my surgeon, wonderful man, I'm a very good friend now with him, he told me that basically you're bleeding out, and if we don't do something within the next 30 minutes, it could be fatal. So, of course, we all know how that can go. Anyway, so I had about 30 minutes to contact my family, contact my girlfriend at the time, contact everybody I loved and let them know I'm going into surgery. I sort of went into shock. They had to give me a few things to calm down, and next thing I know, when it comes to open heart surgery, they shave your chest and legs and everything, and so that's what happened. They told me that the room I'm in right now, at that point in time, they said that I would be in that room for a week. And at that point, I started getting loopy, and I could see everybody looking around me. So I said, okay. Next thing I know, I'm on the OR table, and they're restraining me, and that's all I remember. I woke up 2 days later, and they kept me intubated for 2 days. I was in restraints. I guess I was a little agile at the time being, not knowing where I was at, this and that. But I woke up, and that's the main thing I asked the anesthesiologist. I said, am I going to wake up after this? And she said yes. I went to a hospital, it's called Morton Planning, Clearwater, Florida. They're one of the top 100 cardiothoracic surgeon centers, and I was at the right place at the right time. But to get back to my story, I went through the 36-week rehab program. I'm kind of getting ahead of myself, and I do apologize. And I hope people are watching and learning. I had a very tough time in the beginning. I was in a bed, and I didn't know what to expect. So I was on a breathing tube, and I had all these wires hooked up, and I'm thinking, I'm 28 years old, I shouldn't go through this. But that was a selfish way of thinking. So after that, I thought, I'm blessed, and here I am. They explained to me the operation. They explained to me everything that there were a few complications in regards to my carotid arteries that they had to take care of. Other than that, everything went well. The surgery was 9 hours when it was supposed to be about 4.5, they told me. That's the surgery part. Recovery was what it was. When you have open heart surgery, you have to fight for what you believe in. You have to have the willingness and the power and just the strength of your family, friends. If you're religious, you just have to have that with you all along. So, and I did. I didn't give up. I ended up going through my rehab in the hospital. They got me back up walking. They got me everything I needed, and things have changed suddenly. And thank you, Jennifer. I figured I'd do this on live. It's a little embarrassing, but you know what? I have a story to tell, and that's what I want to do. I want to tell a story. Excuse me, moms, I'm embarrassed. But I remember my first time walking, and I'll share the photo when I'm finished here. My first time walking. Finish. You guys there? Can you hear me? See me? I lost connection for a second. Can you guys see me? Anybody? Jennifer? Hello? Yes, okay. Whew. It's like I'm telling a story now. Anyways, so I walked for the first time, and they made me walk 30 feet with a tank of oxygen in the back, and I thought I could do it, so I tried to jump out of bed, and I realized, wow, my legs aren't how they are. They're swollen. So I did that, and the smiles on their faces of me being so happy to walk again is priceless, and I will post that photo. Over time, I spent a whole week in the hospital. Over time, I learned to walk, and things got better over time. But the last day I was there, I was a little bit of in a rush to get home, of course. You spend this much time in the hospital, you realize, yes, I can easily say this hospital saved my life, and I'm grateful to God that, I was at the right place at the right time, because it could have been worse. So anyways, I got home, and I realized, wow, this is tough. I have nobody here to help me besides my mother, and she had to lift my legs into my bed just for me to go to bed, and I had to lay a certain way on the bed to be comfortable all night. So they, I'm on a lot of medications. I'm sure people that go through this are. I enrolled into the cardiac rehab program. That's 36 weeks long, and it's well recommended. I completed that, and trust me, at first, somebody my age going in, seeing, 60, 70, 80-year-olds, on a treadmill, I'm thinking, okay, well, wow, wonderful, Coming from a guy that used to run cross-country and track in high school, and I still, well, not now, but at the time before I ran. And I learned to quickly adapt and say, you know what, I need to get through this. So 36 weeks later, here I am. I have been signed off by my doctor, and my doctor told me that things are great. I did unfortunately end up back in the hospital 2 weeks ago due to what they call a pleural effusion and also a pericardial effusion. So I had fluid in my lungs and also fluid in my chest cavity, and it caused severe pain in my shoulder and severe pain on my side. And I didn't know how that was going to go. A pulmonologist came in and looked at me and said, did the nice little jelly thing. Everybody, thinks it's cold. I like it, actually. It seems like a massage almost. He said that there's hardly any fluid. I can't put a 16-gauge needle in. I said, well, what are we going to do about it? He said, well, we're going to give you a course of antibiotics. and go from there. So ultimately, long story short, I went back for a bilateral scan for my, this is my scar. Like I said, I just want to show it. You know, this scar is my battle scar of life, and you know, it means a lot to me that I survived and have another chance at life. But anyways, getting back to the story, scans came back good. I got released 2 days ago from my doctor, but I'm still taking things easy. Like I said, going through open heart surgery at the age of 28 really opened up my eyes and realized to me that being this young, you're not invincible. And all those energy drinks that, you know, the kids drink, that I used to drink to get through work, you know, okay, it's okay to have a coffee or have one here and there, but I was drinking probably 3 to 5 a day just to try to get through in 70-hour work week, and you know, that contributed. So altogether, what caused the issue? They found out that I have a genetic disorder. My aortic valve, instead of it being a tricuspid valve, it's a bicuspid valve. And also the valve specialist, he told me that I have a connective tissue disorder, so the tissue itself with the heart muscle, it elongates the right way, but it doesn't, I don't know the terminology, but it actually doesn't do that like it should. There's problems with that. So, you know, here I am now sharing my story. To make, the addition to my story that I didn't want to write because it would take a while, and said, I'm sorry if you guys have to watch this. I hope it's motivation for everybody. My surgeon, I saw him 2 days ago when he released me, and I don't have insurance at the moment. I'm going to be honest, I don't have insurance. I work in pharmacy, and I don't want to name names due to HIPAA, or, you know, I just don't want to get sued, pretty much, if you want to have a laugh. I signed up for insurance 2 days before I went into the hospital. It's not, of course, we know that's not enough time. The day of my surgery, and back in July, I actually got a phone call at 2 p.m. saying, we're sorry, we're going to have to let you go. And this was a surgery that was just supposed to be a valve replacement, aortic valve replacement with a mechanical heart due to my age. It turned into a much more serious of an issue. I was dissecting on a CT scan. So I didn't have a job, so no insurance. The hospital did everything they can to help me out. It's a non-profit hospital, and they're amazing. So back to the story. My surgeon, I went in 2 days ago. My blood pressure was just through the roof. I was stressed. I had anxiety. I just didn't know how I was going to get through the next, honestly, month of my life. What am I going to do? I have no job. I'm 28. I've worked since I was 14. I'm a hardworking man. So I told him the story. I know the nurse there, very nice, wonderful man. I talked to him about it, and the surgeon came in to see me to let me know my scans were good. Everything was great. Everything here. If you haven't seen my scar, I don't know how many people are going to be seeing this. I hope you can see it well. Sorry, my hands are a little shaky. I got a nice little hook. And you know it goes all the way down to the chest tube area. Wish I can get a good view of the chest tube. Anyways, I told him I didn't have a cardiologist, and he said, you should have one by now. I said, well, I don't have the money. I said, my father, my mother are doing the best they can to support me with the necessities of life that I need, you know. Transportation to and from the hospital, anything you describe as a necessity. And he heard my story, and he has a good, you know, way with the hospital, and he actually called the cardiologist, and the cardiologist, he's the head of the department there in cardiology, as you would say, and told the story before I even left and said, no, I want him under my care free of charge. And basically, I've wanted to tell this for the last day, I just haven't. I'm blessed to have a cardiologist, which is probably going to do a Holter monitor on me. I've had some little, but I wouldn't say complications, but bumps in the roads, and I'm lucky. I'm blessed, and somebody's watching out for me, and that's what I have to say. But like I said, my name is Ryan, and I'm 28 years old, and I've went through something traumatic, and now it's how to get through it. And I will say one thing, that PTSD, I had a nurse that saw me. She was a wonderful woman. Sorry if you don't mind me walking around. She actually told me if I don't talk to somebody, I'm going to develop just memories. You can't move on. You can move on, but you're just going to have these memories. And I have weird dreams at night. I don't know if they're from the 6-7 medication, I'm sorry, anything like that, but I'm having a hard time struggling with the fact that life went the way it did for 20 years of my life. I was working since 14, now I don't have a job. I'm actively looking, but in the long run, God bless. I mean, it was there. Somebody watched over me and said, it's not his time to go. It's time for him to have a second chance at life. So, I at one point was a little depressed, and I would sit on the couch and just think, what's there to do? What can I do? And I learned talking to people actually really helps. So I'm going to cut this video short, and that's what I wanted to say. I'm sorry if you have to watch this and you think it's too long, but I support the group, and I support everybody that's had this sort of problem, and anybody with open heart surgery, valve issues, please, just reach out to me. I know I'm young. I'm 28. I'm in the medical field, but it's one thing to know that you're going to go into surgery on a Friday, and it's another thing to know when your surgeon that you don't know at the time says, we need to get him prepped in 15 minutes and ready to go. That was the scariest time for me and also my family. My mother was there, and she was, as you can tell, don't know if many of you have been through it with loved ones, but yeah, it is, Jennifer. It's one day at a time. That is what it is. So that's my story, and I hope everyone respects me going live to tell that story. I haven't told many people that how I feel. A lot of people ask, hey, how was it? I try to keep it simple, but thank you for listening to me, and I hope everyone has a blessed and loved day. And if anybody has any family members, friends, anybody going through the same issues or something similar, heart-related, please just let them know they're in my prayers, and God bless. So, hope everybody has a good day.